the international crisis around the Zika epidemic in Latin America continues to rage, access to contraceptive methods and reproductive health care have become top headlines. On behalf of Women Care Global, I had the opportunity to travel to Puerto Rico to speak with people from the private and public sectors who are coming together to address this crisis and to ensure that we can keep women and their infants safe from this devastating virus. Hello, Dr. Zorrilla. You're seeing a lot of women who are pregnant with Zika. What do we know about what might happen, the likelihood of problems with Zika?
Okay, there's a lot that we do not know. There's a lot of things that women have seen on the media. For example, the microcephaly, which is extreme abnormality where the fetus has a really small head, but it's not that the fetus has a small head, it's that it has no cortex. This baby might not be able to talk, might not be able to walk because the virus destroyed those areas. That is estimated that might happen between 1 and 13% of women who get Zika in the first trimester. When they follow women from Brazil who got Zika in the second and third trimesters, some of them had babies who did not grow adequately in utero. Some of them had babies who died at 36 and 38 weeks. That's in the 8th and the 9th month of pregnancy. The baby was okay and died.
The Zika Contraception Access Network, or ZCAN, was established by the Centers for Disease Control in 2016 specifically to address Puerto Rico's Zika outbreak. The goal of the ZCAN project is to establish a network of healthcare providers and clinics to provide contraception options same day and free of charge. I sat down with the medical director of the ZCAN project at the height of the Zika outbreak. When I spoke with Dr. Bracero, 100 pregnant women per week were being infected with the Zika virus. Given what you've learned about the access to contraception, the difficulties that women had before the ZCAN project, once the ZCAN project is completed, what will be different? I mean, will there be sustainable access to contraception after the donations are done?
So that's a very important question, Dr. Culwell, because ZCAN has two big components. One component is to have a response, a timely response to the Zika threat. The other component of ZCAN is to establish a legacy, to lay down the tracks for us to have a serious and effective claim for better contraception services for Puerto Rican women. And so hopefully we can achieve both of those goals. Access to contraception should not be something that happens to be triggered by a crisis such as Zika. It should be something that should be clear in the mind of the policymakers as a way to promote better female health. The data is clear that when you have a healthy female population, your entire country does better.
Well, and it sounds like through both documentation of what women actually choose when they're given the choice and proper information, but then also you're going to have created, a population of women who have had their needs met and who will talk to other women about that and who will talk to hopefully their policymakers and their doctors. And once women have had proper access to contraception, it's sort of hard to bring that back.